The following is a presentation for patients prescribed Coumadin, also known as warfarin. Please give us a few moments of your time for this educational video. Welcome to BAMC, and thank you for allowing us to be part of your care. We would like to spend the next few minutes discussing an important safety issue. You and your care team have decided that Coumadin will be part of your medication treatment. Coumadin is a medication that has been around for many decades, but it requires close monitoring and can be dangerous if not used correctly. We would like to show you an interaction between a patient and their provider discussing Coumadin therapy.
Good morning. How are you feeling today?
I'm doing pretty good, sir, all things considered.
After careful consideration, we've decided that Coumadin would be the right medication for you.
Coumadin? I think my neighbor takes that medication. Is it safe?
We think this is the right medication for you. Many medications can be dangerous if not used properly. Coumadin is as well.
Along with taking your Coumadin according to your schedule and following diet guidelines, having your blood drawn to measure your response is vital. The lab that measures your Coumadin is called the prothrombin time. The number your healthcare provider will use to monitor you is the INR, which is short for the International Normalized Ratio. A normal INR for someone who does not take Coumadin is about 1. Your own goal is set by the healthcare provider who decided you need the Coumadin. Your goal may be 2 to 3, 2.5 to 3.5, or a different range depending on your personal situation. Time between lab tests will be affected by changes in your Coumadin schedule, other medication changes, and changes in your condition, such as needing a surgery. You will need to have a lab drawn as often as once a week or as far apart as every 4 weeks. You will need to follow your healthcare provider's instructions.
What are the side effects?
The most common adverse reactions from Coumadin are bleeding and bruising.
My neighbor said that she can't eat anything green because she takes Coumadin.
Vitamin K is found in many foods we eat, such as green leafy vegetables, and it can have an impact on how well Coumadin works.
Hello, I'm Lieutenant Ashley Brewer, a registered dietitian at Brooke Army Medical Center. Today, we're going to talk about the medication Coumadin and how your dietary intake is involved with managing your medical goals while on this medication. Coumadin causes your blood to clot more slowly due to its effects on vitamin K. In order for your Coumadin treatment to be effective, you need to control how much vitamin K you get from dietary supplements and food. It's ideal to keep your vitamin K intake consistent. One suggestion is to eat no more than a half cup of a high vitamin K food per day. Additionally, it would not be wise to have large changes in your intake of medium vitamin K foods. High vitamin K foods include broccoli, Brussels sprouts, endive, kale, collard, mustard, and turnip greens, green onions and scallions, parsley, spinach, and Swiss chard. Medium vitamin K foods include asparagus, cabbage, black-eyed peas, kiwi, romaine and green leaf lettuce, okra, prunes, and watercress. Cranberry juice, fish oil, ginger, and garlic are other things that may affect blood clotting and may need to be limited. We recommend you carefully evaluate any dietary supplement you are considering. One containing 25 micrograms of vitamin K per tablet might be okay, but we do not recommend taking any supplements that contain greater than 100 micrograms of vitamin K per tablet. We also advise that you evaluate the vitamin K content of any liquid nutritional shake you are considering. If you change your diet for any reason, be sure to tell your healthcare provider. Brooke Army Medical Center dietitians are available to review more dietary information with you if you need more guidance on foods with vitamin K.
We eat a lot of salads at my house. Does this mean I can't have them anymore?
No, this doesn't mean you can't have them, but you do have to be careful how much you eat. You'll be required to monitor your diet, and you should try to be very consistent in the amount of vitamin K containing foods that you eat. You also have to be careful with other things like alcohol and cranberry juice. We can give you a written list of foods that can affect how Coumadin works.
Well, I take a lot of other medications. Is it okay with that?
Coumadin can interact with many medications, vitamins, and over-the-counter supplements. We'll adjust your Coumadin dose initially based on your current medication list, but you should always talk with your doctor or pharmacist before you start any new medications. Antibiotics are a common source of interactions, and you should always let every provider know that you're taking Coumadin.
When taking this medication, it is important to be aware of its possible side effects. While bleeding is the most common side effect, you should always call your provider immediately if you experience any of the following signs of serious bleeding. Bleeding from anywhere that lasts longer than 5 minutes, any blood in your urine or stool, vomiting or coughing up blood, any unusual bruising, any severe headache or stomach ache, any unusual dizziness or weakness, and any time you fall and hit your head. Many prescription and over-the-counter medications can interact with Coumadin. Common medications that can interact with Coumadin include antibiotics, certain antidepressants, seizure medications, hormones, and certain cholesterol medicines. Many anti-inflammatory pain medications, both prescription and over-the-counter, can also interact. Even things like vitamins and herbal supplements can have a significant impact. You should always talk to your provider or pharmacist before taking such medications.
Is there anything else I need to know?
The most important thing is to always take your medication exactly as directed. Coumadin may not have the same dose every day or even every week. We essentially customize the dose to exactly what your body needs. If you happen to miss a dose or take an extra one, we always need to know. Communication with your healthcare provider is very important. Are there any other questions that we can answer for you today?
I'm sure I'm going to have more questions later, but I can't think of anything right now.
Please make sure you ask any questions that may come up. Your healthcare provider, nurse, and pharmacist are all good sources of information regarding this medication. Many patients are enrolled in a clinic especially for patients who take Coumadin. They may also provide more in-depth education.
We understand that this scenario may not answer all your questions or concerns, but we hope that it provided some answers. I would like to take a moment to summarize the key points of the discussion between the doctor and patient. Coumadin can be dangerous if not used correctly, and it requires frequent blood tests for monitoring. Coumadin can cause bleeding and bruising, and you should report anything abnormal to your provider or go to the emergency room. Having a consistent diet is important, especially in regards to vitamin K containing foods like green leafy vegetables. Taking medication every day as prescribed is key to maintaining your Coumadin level at the correct range. Always communicate any changes in your health status, medications, and diet with your healthcare provider. Thank you for giving us your attention for the past few minutes, and we hope you found this information helpful. Thank you for allowing us to be a part of your care, and remember that consistency is key.